Whoa. Slayer showdowns, split decisions, and face-offs that will make you say, Today, we are breaking down and reacting to all of the insane medical scenes and unearthly injuries from the highly popular video game Doom Eternal. Let's dive right in. Oh, almost looks like the humerus. The bone is actually in sharp edges, and that's kind of actually what happens in real life. When the bone fractures, it's not typically a perfect snap. It actually goes in different angles. A lot of times people will have a bone that is displaced, and we have to actually put it back in anatomical alignment. Sometimes we have to be careful not to slice our own fingers. Wow. In through the mouth, right to the front part of the brain. Frontal part of your brain, personality. You typically will see people who get meningiomas or tumors of the brain in the front. Things start to change. They're not showing like outward signs of my arm doesn't work, I'm having weakness or numbness. They're actually having a little bit of personality changes, and that's kind of like one of the early signs. And then late signs are headaches, nausea, vomiting, people passing out. People say, okay, hey, the temple or the side of the head is the softest part. There's no real soft part. You touch your head, it's hard. But could the bone be a little bit thinner in those areas? Yes. So could it have the easier potential for a blade to go through? Yes. But very rarely do we see puncture wounds and injuries going that direction. Most of the time it's like front and back. Front and back! These type of injuries don't come to the emergency department. There's no head, not something I'm going to be dealing with. Then people always ask, oh my gosh, how long does the body live for? You're gonna still have some twitching, some moving, but just for a few seconds. Could there be a little bit longer twitch or a non-specific movement thereafter? Yes, but it's not purposeful. Was that just a saw? We've seen a lot of chainsaw injuries that come to the emergency department. I've seen people getting just a simple laceration to their tissue, maybe hit an artery, maybe hit a vein, close it up, to chopping off fingers, hitting the bone, hitting your own head by accident. I've seen people's hair get caught. In that circumstance, the arm is gone. That is when you would use a tourniquet. Oh my gosh. Tears the person from the clavicle over. The clavicle, most people probably know, it breaks pretty easy. If you fall on your shoulder, it could snap really easy. You can also dislocate it in that area if your scapula has a fracture, your first rib, or your sternum. You have to have a high index of suspicion that there's even something worse going on underneath, because those bones take so much force to actually break. Oh, there it is. You see the vertebral bodies going up, and then again, you're seeing other organs on the inside. Have I ever seen this come into the emergency department? No. Slicing the brain in half and the spine and all that connective tissue. If you get deep enough into the thoracic cavity, you're gonna hit the heart, you're gonna hit the aorta, and you bleed out and die anyway. We see a lot of blunt trauma to the side of the head, and we always worry about the middle meningeal artery. That can cause an epidural hematoma, and you can have a phase basically where you're like, I'm fine, and then you're not fine, and you can herniate. So puncture wound to the eye, you actually see brain matter and maybe skull fragments going flying backwards. It's actually kind of more realistic. If you get so much trauma to your eye, you can't really replace your eye. Hopefully we can soon. Oh, they just love those humerus injuries.
You get people who've got a right funny bone.
Different type of humeral fractures. Proximal, it kind of stinks, but it'll heal pretty well. Midshaft we worry about because the nerves and the blood vessels kind of cross underneath in that area. And then distally relating to the elbow and a joint. If the joint is involved, then you have a higher chance for chronic arthritis. Whoa. Eye gouging. I've never seen an injury like that. I've seen people get poked in the eye. I've seen different types of things that cut the eye and traumas, but not somebody else's finger. It's gotta be really painful. And then obviously ripping somebody's skull apart. Not really gonna happen. We have all those like suture lines. You've seen skulls where they have all like the zigzags because our skulls grow as we get bigger and then they stop. And then those suture lines actually fuse together. Whoa! Get out of that situation. Do you bring the legs with you? Yes. Because if it is actually a quite clean injury, there is replantation teams basically where they can actually try to use your tissue to replant the limb back on. I've had traumas where people left it on scene and never brought it. And if you don't have it, you can't reattach it. Okay, so this massive eyeball just being pulled out. What? So our eye has lots of attachment that keep it in. You got 6 muscles, top, bottom, left, right. And then you got some crazy obliques that do this nice movements for us. And then you have the optic nerve with the blood vessels hitting in the back there. Some people have like bulging eyes that are coming forward. And a lot of times we see that in hyperthyroidism. One of the ways we actually test for it is we'll actually look from over somebody's head to see if their eyes are coming further out from the bridge. There's that humerus. Super cool. Actually see the blood in the middle of the bone, so the bone marrow. And there's really cool meshwork of the bone and the structure of the bone where the blood flows through. And I bring this up because we can actually drill a needle. We call them IOs or interosseous, where we can actually put fluids and meds through that. Whoa, okay, so compressive force squishing the neck. We see so many vertebral compression fractures. Now, do we see them like this? No. But we see them when people fall. We see them when people get older and they become more osteoporotic, meaning their bones are a little bit more brittle. Simple things can actually cause their vertebral body to collapse. Oh, whoa, whoa, whoa. Good direct hit to the chest, puncturing the heart, puncturing the lung. If you have a direct blunt trauma to the heart, it's actually still survivable. That's why we do different major invasive emergent procedures at the hospital. A thoracotomy, where we literally crack the chest open, get to the heart itself, and see if there's a hole or a puncture wound that you can actually fix by staples, sutures, anything like that. Just get it to stop. Okay, just massive trauma to the skull, causing the brain to be just destroyed and crushed and brain matter everywhere. So we see people who get skull fractures. You can get a skull fracture from like very minor trauma, but most of the time it has to be a significant amount of force onto like a hard object. When we see people who have intracranial bleeding and subdurals, a lot of times we actually don't see skull fractures. I would say more often than not with head trauma, I see brain bleeding versus a skull fracture when it's that bad. What? So you can see a bunch of intestines on that one. And they're all different like spots instead of just like the classic string of intestines that we see. It was actually just like bundled up in there and then sliced. So they did a good job. Whoa. Wow. Bilateral lower extremity amputation, AKA his legs got chopped off. If I say AKA, to me, that also says above the knee amputation. And then we say BKAs, below the knee amputations. So it's very funny the terms that we actually use in medicine. This was intense. Almost as cool anatomy as like Mortal Kombat does. So if you guys enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.